Everybody, I'm Dr. Barrett. I'm a board certified plastic surgeon right here in Beverly Hills. And I get a lot of questions about the durability and the lifetime of an implant. In terms of how long do my implants last? Well, theoretically, they could last longer than you live, okay? But it's kind of like riding on tires that are meant for a certain number of miles. I know that's a bad analogy because it's not very sexy to talk about car tires and breast implants. I mean, these are going in your body. I will say that they are very well manufactured. Compared to when they used to be manufactured, they would actually leak quite a lot. There wasn't any protocols, there wasn't any inspection, there wasn't any FDA approval for breast implants when they first came out. These shells are made of silicone, but they weren't very durable, and so they would leak a lot of silicone. Now the implants they make are called gummy bear implants. If we were to cut this open, the gel doesn't run onto the floor like it used to. It used to be liquid, it could run into your body. Now it's called cohesive gel, so that the gel stays within the implant capsule. It doesn't go everywhere else. That being said, it could still be very irritating to certain people. In fact, it's about 30% of people that it would become irritating if it were to rupture. So if you do have a ruptured implant, it's recommended that you take it out because you don't want that irritation. That irritation could lead to capsule contracture, it can lead to pain, it can lead to other problems, stimulating autoimmune things that could give you what's called breast implant illness, perhaps, or upregulate other things or flare up certain things in your body. So basically, an intact implant is very, very inert. If you have a contaminated implant, that could be a problem. That can cause capsule contracture. That's why I do a lot of different things to help prevent capsule contracture in my surgeries. Triple antibiotic irrigation, Keller funnel, no-touch technique, change gloves, all that stuff you see me do in my videos. That is to prevent contamination in the implant. But the implant itself, how long does it really last? If you look at the data, now the different companies have different data. If you look over the time period of about 10 years, the rupture rate is really, really, really low. It's like less than 5%, okay? So it's really, really low until about 10 years, and then it starts to go up like that. Whether it's Allergan, Sientra, or Mentor. Mentor is typically what I use for most of my my surgeries. So what I tell people is, yeah, you can kind of leave it in if you want beyond 10 years, but I would recommend you get some kind of screening like an MRI or so forth. However, that's a big process. It gets expensive. So in my opinion, implant swap out at 10 years, if there's no other issues going on, is a 45-minute operation. Basically, it's like getting your oil changed. Another car analogy, I'm sorry, but it is. It's basically something you want to do routine maintenance, swap it out, put a brand new one in. Or you can go get an MRI every 2 years to make sure you don't have a rupture. So why do that? The FDA does recommend you get an MRI every 3 years when you have implants, but I tell people, my recommendation is that just have them for 10 years. Unless something traumatic happens, it's very low likelihood that they would rupture. And swap them out at 10 years, and then you don't have to deal with getting an MRI on a routine basis. And I've had implants last intact for 30 years on some patients. They're not my patients, obviously, because I'm not that old. But I have taken out 30-year-old implants, and they were completely intact. I have a whole implant museum, actually, of all the different implant relics and different types of style. I'm just kidding, I don't have that. It's kind of gross, actually. We send off the medical waste all the old implants, and sometimes they come out with nasty stuff, so we don't want to keep that around the office. Plus, rent in Beverly Hills is super, super expensive. We can't afford to even have storage space. So my recommendation is swap them out at 10 years, then you don't have to worry about a blowout, right? So you drive on a tire, it's meant for 50,000 miles, but you're on 80,000 miles, guess what? You're more likely to have a tire blowout, okay? So that's why I recommend 10 years according to the data. Until that data changes, my recommendation stays at 10 years. But theoretically, they could last a lot longer, but you don't want to risk that for your body. All right, so that's it, you guys, for our implant durability, and not so much durability, our implant longevity topic. If you have any questions, make sure to leave it right here on my YouTube page. I will get back to you. And if you want to see more cool videos like this, don't forget to give me a thumbs up and subscribe. Thank you guys. Have a wonderful day.